Good evening, everyone, or good morning, depending on what part of the world you're currently in. It's wonderful to be joining you again. So my name is Jason Roberts. I'm lucky to be the director of the Centre of Research Excellence called Respond, which was formerly known as CRE Reduce. And this tonight is just another one of our wonderful educational hybrid events where this time we're fortunate enough to be presenting on paediatric antimicrobial optimisation. We have some fantastic speakers and an excellent chair that I'll introduce you to very soon. Before we get underway, I'd like to just give an acknowledgement of country, and on behalf of the University of Queensland, recognise the traditional custodians of the lands on which we meet, which in Brisbane, where we are currently based at the moment, is the Turrbal and the Yagara people. We pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. So this is the another edition of our education program, of which we have about 9 different events over the course of 2022. They all continue to be very successful, and I mean that in the context of the number of people that attend and the very nice feedback that is provided for these. And so we encourage each of you that are able to provide feedback to give us that, such that we can continue to design these presentations and events to be as fit for purpose and useful as can be for your future enjoyment. This would not be possible, of course, without the sponsors that continue to support our work and education in infectious diseases. And so I'd like to recognise CHU NIEMS, which is a hospital university in Nîmes, which is a very strong education and research partner of the University of Queensland, as well as Pfizer, Gilead, Baxter, and MSD. We're very grateful for their support and for enabling this paediatric antimicrobial optimisation webinar to occur. So the program for today, as you can see, is on this slide here. We'll begin with a presentation from Susie Parker, which is really just to introduce the later presenters. And we have 3 excellent presenters indeed. Francine Hosking, who is a neonatal fellow here at the Royal Brisbane Women's Hospital. Very excited to hear her presentation on antimicrobial optimisation for neonates. Then Dr. Sainath Raman, who's a senior research fellow and a paediatric intensive care physician from the Queensland Children's Hospital, presenting on antimicrobial optimisation in paediatric patients. And then finally, we have an international flavour from the Netherlands, who's Dr. Robert Flint, who has fantastic clinical and research expertise in the use of dosing software, or more specifically, model-informed precision dosing. And we very much look forward to his presentation before Susie takes back controls for the question and answer session to follow. So now I'd like to introduce Susie Parker, who is very much a shining light in our research group, and who leads a lot of the paediatric antimicrobial optimisation work at the University of Queensland in our centre. Susie is a research fellow in our centre, and she is the Deputy Director of CRE Respond. She has extensive experience in designing, conducting and analysing trials for paediatric pharmacokinetic studies, and developing innovative dosing regimens to ensure that patients are able to achieve the best possible outcome with the therapies that are indicated for their treatment. So I'd like to invite Susie up to continue chairing for the rest of the meeting. Thank you, Susie.